Ein sehr, sehr inspirierender Mensch, wie ich finde, auf dessen kritischen Blick und auf dessen klare Ansage zum Status quo der globalen Gesundheitsversorgung und ihrer Ungerechtigkeiten wir uns jetzt freuen dürfen, ist unsere Keynote. Das ist Dr. Ayoade Olatunbosun-Alakija. Wir freuen uns sehr, dass sie heute da ist. Sie ist unter anderem, muss man sagen, Ko-Vorsitzende der African Vaccine Delivery Alliance von der Afrikanischen Union. Sie ist Gründerin des Emergency Coordination Centers in Nigeria und sie war auch ehemals Chief Humanitarian Coordinator des Landes. And now I will switch to English for the direct introduction. Ayoade, we are really honored to have you here tonight, and we are very, very grateful that you took the time in your really busy schedule, we know that, for being with us here tonight. So please, the floor is all yours.
Thank you very much. Thank you. Thank you, Max. And I'm really honored and happy to be with you too. Well, I don't know whether happy is the word. I'm honored to be with you all today, to be delivering this keynote address at this sobering moment in global history. I'm also sad that it is necessary to speak like this, but the events of the past week alone, never mind the past 20 months, has made it even more imperative that those of us from the global south speak to those of you from the global north in a bid and interact in a bid to help you to understand that this global system of ours is broken. The global system is broken, and I think in Germany today, the waves of the Omicron variant of the SARS-CoV-2 virus are reverberating across your own country, even as the virus is marching across the world. Today in Germany, you announced a lockdown for all unvaccinated persons because it has become a choice whether to become vaccinated or unvaccinated. In other parts of the world, in Africa, in Abuja, Nigeria, which is my home, there are also some bans being put in place, but mainly they're travel bans from countries of the global north, from rich countries, from Canada and Israel and various other countries of the world, more and more every day, on countries in Southern Africa, on countries like Nigeria, because there's a variant spreading. The global system is broken because we have chosen not to be our brother's keeper. We have chosen not to choose common humanity in this moment, but we have chosen to choose selfishness. We have chosen to forget that if we do not look after the whole world, that none of us in the world can be safe. Why do I say this? I say this because when the pandemic started 20 months ago, 22 months ago now, you know, the days for me are fading into months and weeks and hours. I'm no longer able to tell where it is because we're in a desperate fight for the life and for the core of humanity. But when it first started, it started in the East, and then it migrated its way to the West. And the West took it seriously, and there was a rush to acquire, to develop vaccines. Your government, Germany, did an incredible job in supporting BioNTech and Pfizer and came up with one of the very first vaccine. But then we have failed going forward. We have failed because we have failed to share diagnostics with the world. We have failed to share therapeutics with the world. But most importantly, to stop this virus, what we needed to do was to share vaccines in an equitable and in an urgent manner. To vaccinate healthcare workers across the world. In Africa, only 1 in 4 healthcare workers, that is registered healthcare workers, has been vaccinated. And yet hundreds and thousands of them have died over the course of the past year because they have no PPE. I heard Max, even though I don't speak German, I have a little bit of an understanding of what he was saying earlier. So they have no personal protective equipment, but they have sworn an oath to care for their patients. So yet they go to work with plastic bags over their heads. They go to work wearing no gloves. They go to work desperate to try and save humanity, to save you and me. They're not just Africans that they're trying to save or people from low-income countries. You, the audience, must also remember that there are German citizens in the low-income countries of the world. There are Germans in Africa. There are Germans in Asia who also if these people, the healthcare workers, cannot care for them, will also die. They may have had access to your fantastic vaccine because maybe your embassy, which I know, I interact with ambassadors from all of the different missions. So some countries have brought in vaccines into low-income countries of the world for their own little group, for their staff, to care for their staff. But what if your staff member has a heart attack and needs to go to a hospital and there is nobody there to care for them? Or all the health workers are sick or they're dead? That is what is happening in some countries. One institution, a multilateral institution, I shall not mention the specific one, just yesterday lost a staff member, a woman in her 50s. They think it was a pulmonary, something to do with her chest. She was unable to breathe. But the UN family in Nigeria is in mourning today because somebody died. Somebody died because the health system is broken. The health system is broken because our global system is broken. Our global system is broken because we have forgotten that we need to care and we need to share and we need to work together as a global community in global solidarity. So my message to you today is simple. You are giving a prize. The Memento Prize is much vaunted. It's valued in your community. But I say the prize that we all should be seeking for in this moment in time is a prize that shows that we can understand that in this once in 100-year event, we need a once in 100-year level of global cooperation and solidarity. That we need a once in 100-year level of kinship, of friendship, of cooperation, and of coordination. So far, this entire global pandemic has been beset by little bickers and little bickering and arguments between, the UK and the EU and the US and China. But I urge us all to lay all of that down and remember that we are potentially fighting an existential threat to our very humanity. Why do I say that? Today we have the Omicron variant. We don't know what that is going to do. So far they're saying it is mild, but we're only saying it is mild because it is early days yet. We don't understand what this virus is. We don't understand its power. The previous one, we only started to see after weeks and months. People were dying only after they had been infected for a few weeks and a few months. Omicron could turn to Omega. We could have gone from the Alpha variant, which started in Kent in the United Kingdom because of a total disregard for public health measures, because of irresponsible leadership in managing the pandemic. It could go from that Alpha to Omega in the course of a year or a year and a half. Will we be able to manage the Omega variant? Will we have the vaccines to deal with the Omega variant? You can vaccinate yourselves in Germany all you want. You can vaccinate yourselves in Europe or in America all you want. You can get 3 boosters, you can get 4 boosters. But until you get jabs into arms of those in the low-income countries of the world, this virus will continue to replicate. And as it replicates, it will continue to mutate. What I say often is that this virus is smarter than many of us human beings. It is smarter than many of our political leaders, be they from the global north or from the global south. And I urge you listening today to prove that it is not smarter than Germany, to prove that you will do the right thing, that you will take global leadership in this moment. Just a few weeks ago, I was in Berlin at the World Health Summit. I had a wonderful welcome from your country and from many of your countrymen. But most importantly, I had an incredible welcome from your young medical students, the German Medical Students Association, who embraced me literally after I had spoken and called for a world of change, called for a world of transformation in this moment. And they embraced me and said they were happy that I had said not just what everybody else will say, that I was not just going on the usual talking points, the same, but that I was speaking to their hearts. And that gave me hope. It gave me hope for the future, because if the young ones can understand, then we should allow them to lead. We should allow them to take the lead in this moment, because if they know what to do, then we who clearly do not need to step aside. The global order is broken. The power imbalance of the world is shocking right now. We are allowing people to die for want of a simple jab in their arms. We are allowing people to die because of selfishness from high-income countries and because of greed, quite frankly, from pharmaceutical industry. But policy dictates greed, and policy is allowing that greed. We call on all the leaders of the world, the high-income countries, to mandate that pharmaceutical companies share their intellectual property, to mandate a TRIPS waiver, to mandate a sharing of technology. Let them share the recipe and let them share the know-how, because that is the only way we are going to survive this as a global community. I'm okay, you're okay. If I'm not okay, you're not okay. You might be okay at the moment because you have vaccines, you have hospitals, you have therapeutics, you have antibodies. But if I'm not okay in the global south, the variants will keep coming back. The panic is back. It is back to deja vu. We are back to March 2020. Airports are closing. Countries are shutting down. There is panic. We're coming close to the holidays. I'm sure some of you listening have family in different parts of the world that cannot get to you. I am in that same boat. I have a daughter who lives in the United Kingdom. I have my dog who is actually from Berlin. So I am also, ich bin ein Berliner. I am also a part of you. My dog came from Germany. He is in a different part of the world. But I cannot be with them unless I rush and I change flights and I try to escape from like a refugee from Africa, because the world is shutting Africa away. Why is the world shutting Africa away? It is discriminatory, it is xenophobic, and it is bordering on racism. Because this new variant has been found in different parts of the world, and yet it is only Africa that we're shutting away. It has been found as far away as Indonesia, as Singapore. We are saying that many of those cases originated in South Africa, but do we know that? Now they're saying some of the cases originated in Nigeria. Do we know that? Or do we just know that the excellent science and the genomic sequencing of some of our African scientists, because we are so on high alert, because we have such great levels of pandemic preparedness, because we have dealt with Ebola, we have dealt with HIV, we have dealt with polio, we have dealt with numerous cholera outbreaks. So we are alert and we are prepared to deal with outbreaks and threats when they hit us. Should we be punished for that? Or should we be applauded? Should the world say, thank you, let us come and learn from you? That is what the world should do. That is what the prize should be for those of us who have the courage to stand up in this moment in history and say, we are not going to punish Africa. We're not going to penalize Africa. We're not going to punish the low-income countries, but we are going to share what we have. Because you can get 3 booster doses, but until I have 1 dose, until my entire family and household have both their doses, you are not safe. If you are not safe, humanity is not safe. I want to go back as I close to young people. I want to go back to what this moment means in global history. I want to go back to the fact that this is a moment in history that the whole world is rallying around. This is a moment in history, like after the Great Plague, when the geopolitics and the Spanish flu, where the geopolitics of Europe and the geopolitics and the world wars, when the geopolitics of the world shifted. We are in the same moment today. And I think we are, as a global community, we're underestimating that moment. We're underestimating that if we do not shift as leaders, then the world will shift for us. The electorate will shift for us. We have seen it in some countries. The United States last year saw a change in government, largely around the shifting in social structure. It is young people who will bring that shift. It is those who've been disenfranchised. It is those who've been left behind. It is young people, it is girls, it is women who will bring that shift. You in Germany, I have the greatest respect for, because you have a great leader who is a woman. It is women who are making the hard decisions, I have to say with no bias, in this current moment in time. So we have to remember that in moments of great crisis come moments of great change, come moments of great political upheaval, come moments of great social change. And I am calling to you today to recognize that moment. And as a group who are there today, to call for change, to call for equity and to call for justice, to call for the world, for us to vax the world in as urgent and as equitable a manner as possible. It is not just about donating about to expire vaccines. It is about donating the best. Do not give your leftovers. Some countries are sending to Africa vaccines that will expire in 3 weeks that are disrupting supply chains. Do not give your leftovers. Give us your best. We need support in logistics. Germany is incredible with logistics. We need support in delivery, not just in Africa, but all over the low-income countries of the world. Bring your best to the table. Let us jointly get a Memento Prize for common humanity. Let us jointly get a prize for saving this world from the brink. We have climate coming at us, but this COVID is the biggest test for climate. If we fail COVID, we cannot pass climate. Quite frankly, if we fail COVID, we may not get to climate disaster because this could potentially end us all. So I'm going to end on that note. I'm going to end on a note of saying, please, this is not a plea, this is not a beg, but I am reminding us of our common humanity. I am reminding us of the power and the agency that each one of us has. For those political leaders that are listening, those CSOs that are engaging today, I'm reminding you to keep knocking on their doors, to keep pushing with advocacy, to keep pushing with force. Many of us who have done the work of this fight have done so pro bono. Nobody is paying us. We are independent voices. We are voices who want change for humanity. We are voices who want people to live and not to die. So today, as you go into your prize giving, I congratulate the prize winners. I congratulate the organizers. I congratulate Germany for excellent science. But I say also recognize Africa for excellent science and recognize that our lives matter just as much as yours. I thank you.
Thank you very much, Yodi, for these very well put and very passionate words. I think they will surely resonate with us through this evening and definitely also beyond. I'm pretty sure we'll pick up a lot of the points that you mentioned now during your speech. And I think also your plea for solidarity will definitely echo through our discussion later. And for now, I can only wish you, or we as the Memento Bündnis, we wish you strength, we wish you perseverance, and we wish you the needed touch of luck everyone needs in their work. So our hearts go out to you. Thank you very much. And yeah, keep up the good work.